All right, thank you, Elena. Great. So as Jan said, my name is Stevia Diget. I'm a PhD student at Griffith University, and I'm calling this panel contribution, What do Minimal English for Health Guidelines Look Like? And you can go to the next slide now, Elena. So this slide is my one slide, and it presents a visualized overview of the process of my PhD thesis, of course, quite simplified, but essentially the project is working towards designing a set of minimal English for health guidelines, which in this case is going to be focused on COVID-19 and influenza. So the project focuses specifically on Australian public health postures about these two diseases. The project involves identifying field-specific vocabulary, which in this case, of course, is vocabulary related to COVID-19 and influenza. And it also involves gauging consumer preferences for public health posters. After that, the focus is going to be on developing minimal English texts, which will be related to COVID-19 as well as the flu, and also on testing the translatability of these minimal English texts. I'll then be trialing these with consumers. And all of this will then feed into the ongoing process of formulating some sort of minimal English for health guidelines. So for the remainder of this presentation, I'll try to briefly be elaborating a little bit about what each of these steps will entail. So the first step, identifying field-specific vocabulary and consumer preferences, that's ongoing as of right now. So the identification of the field-specific vocabulary has been done by surveying 45 public health posters about COVID-19 and influenza, and these have been retrieved from different Australian government sources. This has resulted in a list with salient words and phrases that are relating to these two diseases. And to identify consumer preferences for these public health posters, I am conducting interviews with health professionals. These are primarily public health doctors. And I'm also conducting a survey with a broad sample of the population, and these people are not health professionals. So in the interviews and surveys, participants are asked to give their opinion on a series of existing COVID-19 and influenza posters. They're asked whether they think a certain poster is any good, why they think that, as well as asked more specifically to comment on issues that they perceive in the posters, if any. So I currently have about 8 interviews and about 70 survey responses. Now, since I imagine the guidelines to include minimal English texts, the next step will be to develop these minimal English texts. They will be developed on the backdrop of the identification of field-specific vocabulary and also on these consumer preferences that I've identified. I'm calling the process of writing these minimal English texts explicitation after Goddard, Van Hatalo, and Welch, which is the forthcoming chapter in the Minimal Languages in Action book. And the process will involve writing and then reworking these texts and testing their translatability with both machine translation and human translation. Now, the machine translatability testing will be done using Google Translate, in this case, English into Danish, because these are the two languages that I have intimate knowledge of. And I plan to use Google Translate for this, knowing that it is an imperfect translator, but many non-native English speakers in Australia do access their written health information in English. And in this day and age, people are very likely to be using their phones and thus machine translation to help them understand such materials. And even if this is not the case, even a professional translator might use machine translation to assist their translations. So I actually think that Google Translate is a really useful tool in this context. I will additionally be translatability testing with human translators, and this is done to gain insight into potential translatability issues in languages I don't have intimate knowledge of. So who's going to provide the translatability testing for this part will be guided by the most commonly spoken minority languages in Australia. So that is in chronological order: Mandarin, Arabic, Cantonese, Vietnamese, Italian, Greek, Hindi, Spanish, and Punjabi. I'll try to identify people within my networks who can help with this task. I've already identified a few people who can help with this. Of course, this translatability testing can easily be expanded with other minority languages, such as French, Portuguese, Russian, Farsi, and so forth. Finally, I will be creating a series of mock-up posters that will be using these minimal English texts, and these will then be trialed with consumers. So that is, I'll be conducting a second round of the interviews and survey. And this will be to see what issues consumers perceive in these new posters, again, if any. All this will help inform the development of the minimal English for health guidelines. Now, at this stage, I'm still tossing up what form they will take. I know that I want them to include advice for how to use pictures in public health posters, and I know I want them to include minimal English texts. Other than that, They could take the form of an electronic resource, they could be a polysemiotic pamphlet, they could be a type of glossary, and the minimal English text could take on different roles in the product depending what it'll look like. I'm also considering what an entry should look like. Should it be a word or a concept, such as a vaccine, or should it be more topically based, such as what words to use? Additionally, I'd really like this to have some snazzy name, like a snazzy acronym as well. So for instance, I've been working with Mega Health, that is Minimal English Guidelines for Accessible Health, but it could also be something like STAP Health, for example, Standard Translatable English Principles for Health, or it could be something else entirely. So as we head into the Q&A section of this panel, these are some of the questions that I'd like you to keep in mind, because I'd really appreciate any feedback on this. Finally, I just want to say that these guidelines can only hope to inform the beginning of a larger framework of minimal English for health communication. This project is just merely the beginning, and I'm just taking on COVID-19 and influenza as a case study for a start of this. Thank you.